Hey guys, what's up? It's Stephanie. I have another video for you guys this week. And the topic of the video today is going to be about patient care experience versus healthcare experience. So I know when I was applying, this was something that really confused me because each school that you apply to does have a different definition as to what they consider as patient care experience and as to what they consider as healthcare experience. So I will be going through that definition, and I also will be talking about my patient care experience and my healthcare experience, and also how many hours I had. So if you are interested, I will be talking about that, and I'll talk to you guys soon. Bye. So when you're filling out your CASP application, it has a portion where you enter your patient care experience, or PCE, and your healthcare experience, HCE. Now each school does require a certain amount of patient care or healthcare experience hours, and almost every school does require you to have both. Now, what is the difference between both of them? So patient care experience is basically when you are responsible for a patient's care. So whether you are an EMT, a phlebotomist, a registered nurse. I know even some schools did list dental hygienist or anything that has to do with dentistry, also dental assistant. So that is what patient care experience is when you are directly involved with working with the patient, hence hands-on experience, versus healthcare experience, which is where you are not directly involved with the patient. This can either be unpaid or paid, and unpaid can also include any volunteering, anything that is clerical, which was what I did. I worked in the ER and in urgent care front desk, so I was in charge of verifying insurances, filing claims, obtaining patients' information, etc. So this is more of healthcare experience. Other healthcare experience is also, I've noticed that medical scribes, it's actually just changed recently in 2017, I believe last year. So it's really important to look at each school and see what they classify as healthcare experience and patient care experience. Also, CNA and medical assistant was moved for some schools for healthcare experience instead of patient care experience. Now, when I applied, the first time that I applied, I had none, so I had 0 patient care experience hours. I only had healthcare experience hours. I had about over 10,000 healthcare experience hours, and that was because in 2012 I started working for the hospital. I worked in the emergency room, labor and delivery, surgery, psychiatry, etc. And during these 5 years that I worked there, I was responsible for admissions. So basically, like I stated before, I obtained insurance, demographics, next of kin, emergency contacts, etc. So I did interact with the patient. I also interacted with the staff that worked in the emergency room or worked in other fields of the hospital or other areas of the hospital, but I did not do any hands-on work with the patient. So this is why this was healthcare experience hours. And the majority of the time I was working 40 hours, and during the summer I did work even 40 hours or plus. Sometimes I had 2 jobs and I would work about 80 hours or more a week. So that was when I was able to rack on so many hours for my healthcare experience. The second time that I applied, I had well over, I think I had about 14,000 hours, about 14,000 hours. And this time I finally had patient care experience. So after applying the first time and getting rejected from the 9 schools that I applied to, basically all the schools that I applied to, I told myself, you know what, I have to get some type of patient care experience hours because the majority of the schools were requiring patient care experience hours, and I didn't have any of that. So what I did is that I started working in the urgent care where I work at. I did front desk, which is just checking in patients, checking them out, obtaining copays, etc. And I started shadowing a medical assistant I work with during my downtime, and she actually was able to show me how to triage. She showed me how to run labs, administer injections, etc. So I followed her around and I was able to learn a lot from her. And within the next year, so the second time when I applied, I was able to do more medical assistant duties than front desk. So I was able to work that, and that's how I got about 1,000 hours the second time that I applied. So I was able to put this towards my application. Now, like I said, now currently I believe some schools do not accept medical assistant job duties as patient care experience hours, so you have to be really careful in researching your schools and making sure that they accept your job duties as your patient care experience hours. So that was just basically what I did. I was thinking about going to MA school or even becoming an EMT so I could get those hours, but I mean, to be honest with you, I didn't want to spend money on going back to school, and I wanted to apply to PA school. So what I did is that I just became cross-trained. So what I advise is that those individuals that are working in the hospital setting, I know when I worked in the emergency room, individuals that were interested in medicine, they were cross-trained, and this was completely free. And there would be individuals that I work with that worked in the same department as I did, doing clerical work, and they were cross-trained to become ER technicians. So, and it was all on the job. So if you have the chance, you know, and you are working in an area like I am, whether you're doing clerical work, you're a medical scribe, just make sure you let the individuals that are work around you, whether it's other ER techs, whether it's RNs, let them know that you are interested in becoming a physician assistant, that you are interested in medicine, and you should be able to be cross-trained. I mean, that's what I did. I saved money and I saved time on going back to school. So I was able to apply the second time and I got in the second time. I barely made the cutoff for most of the schools because the schools that I applied, they required about 900 to 1,000 hours of patient care experience, hands-on hours, so I barely made that cutoff. I think what helped me out was my healthcare experience hours that I had about, like I said, 5 years worth of healthcare experience hours, so this really helped me out in my application. So if you are in the situation as I am, you have a lot of healthcare experience hours and very few patient care experience hours, then I would advise you to definitely apply, because in those 5 years that I worked as in a registrar, it's called registrar and registration, I learned so much in the emergency room from all the people I work with. Working in the urgent care, I learned so much. I was able to work closer to the PAs and I learned a lot more about the careers, etc. So, you know, you also learn a lot from your healthcare experience. Whether you're working or whether you're volunteering, I advise you to get as many hours as you can for both of them, because it all balances out your application. If you have a low GPA, like I did, mediocre GPA, 3.2 science GPA, 3.39, barely made the cutoff to 3.4 for overall GPA, and you have all this amount of patient care and healthcare experience hours, and you know, it's all going to balance out. So good luck, guys. And I just wanted to make this video to basically define and contrast both of them, because like I said, when I was applying, I had a hard time trying to see what I could categorize as patient care and healthcare, etc. So thanks for watching my video, guys. If you guys have any more questions for me, any feedback, any suggestions, feel free to email me. I will contact you as soon as I can. Like I said before, I will be starting PA schools, so if I do take long to respond, please bear with me, but I will respond back to you. And if you know any other individuals who are interested in becoming a physician assistant, just let them know about my channel. I'm trying to get the word out there. That way I help more individuals get into PA school. Alright guys, thanks for watching, and I'll talk to you guys later. Bye!